Hi everyone, this is Aurelie Najm from Glasgow, reporting live from Milan. I'm still at the conference center. I had an amazing day and I learned so much. There were a lot of really good sessions. One of the presentation that I saw today, oral presentation 0268, was really interesting. You know, it's about a topic that is really relevant to a lot of our patients, but that is not really studied a lot. And so it was a study that was looking at menopause in rheumatoid arthritis and the effect it would have on a few different patient-reported outcomes, including pain and function, and also look in the cohort at the effect of the hormonal replacement therapy on different, again, PROs. But the most important one in that study was the hack. And so I'm going to tell you a bit more. So it's a study from the Forward National Data Bank, and it's basically self-reported history and PROs, and they included more than 4,000 patients, actually 8,000 patients with menopause, 4,000 being treated with the HRT and 4,000 not being treated with it. And they looked into different patient-reported outcomes. And so one of the first results that was quite important is that, in fact, after menopause, what happened is people, the hack actually does increase. And in fact, it increased of 0.008 for every year after menopause, which is quite interesting. But also, what we could see is that those who were treated with HRT, they did not have difference in any PROs as opposed to those who were not treated, but the hack seemed to be a little bit lower in these patients. So I don't know if that difference is really clinically relevant to recommend the prescription of HRT, but also anyways, the study did not include any data on safety. So it's definitely too early to propose this in clinics. However, I think this is something important to maybe continue looking at and maybe do further research on. It was Aurelie reporting from Milan. You can follow me on Twitter at Aurelie Najm for more content, to tune out on remnow.com for more content as well. And I'll see you around.